After finishing the interviews at Dr. Lowe's office, our team had a tour of Chiayi City and learned a lot about its unique history and got a chance to see some amazing sights. Then they proceeded to the office of Dr. Lowe's brother, David, where they learned some vital information about the oral link to cancer.
See that picture over there? This is oral cancer, the patient. The soft tissue has necrosis. We still can find these pathogens in the wound soft tissue. Yeah. So any infection patient, she has a lot of combined microbiota. In the gum, we name periodontal disease. In the pulp, we name periapical periodontitis or periapical cyst. In the necrotic tissue, maybe become oral cancer. If I use the correct medicine and I use the, we name APDT, antimicrobial dental dynamic photodynamic therapy, or I use the oxygen plus ozone therapy, and I use the amino acid particle to impact the infected area. This method will kill the microbiota, and the wound will heal very rapidly.
What would the wound be created from?
The origin maybe from surgery, or maybe from trauma, or maybe from cancer therapy, or maybe from periodontal infection, endodontic infection, or dry socket after oral surgery extraction.
So yeah, I know that dry socket can be a big problem after oral surgery, and they can cause a lot of pathogenesis in the mouth, can cause a lot of microorganisms. You were showing me a unique perspective that you have on that, to heal the wound and to regrow the bone. Could you explain that?
First, we need to face the infected material, infected tissue. So we need to find what is the pathogen infect this area. After I know the pathogenic origin, and I can find the good medicine for the patient. Everyone is different. And then at the same time, I use the laser. The cell wall of the bacteria will dissolve. The bacteria will
So you use laser to disinfect the wound?
Yes.
Okay.
This is the second pathway. The third pathway, I use the ozone to treat the infected area. And we can find the tissue will disappear. The necrotic tissue will disappear day by day, days by days, and the new tissue will grow day by day.
Okay.
So they can be cured.
Now, dry socket develops when the blood clot at the site of surgery disintegrates or is dislodged. This condition can cause severe pain, and if it doesn't heal properly, can cause chronic inflammation, and chronic inflammation has been linked to cancer. Something else that has been linked to cancer is mercury, which is the composition of those silver amalgam fillings that dentists like to use. Now, approximately 50% of dental amalgam is actually mercury. Interestingly, thimerosal, which is used in vaccines as a preservative, is also 50% mercury. Here's the MSDS for thimerosal. That's the Material Safety Data Sheet. As you can see, it says that it may cause cancer based upon animal data, no human data found. In a global quest, Dr. Thomas Lokensgaard had some great input about amalgam fillings.
The silver fillings, you're right, they're about 40% silver. The rest is copper, tin, and mercury. 43 to 55% is the mercury in a silver filling. So it's a huge problem. And the question is, do they outgas? The ADA's position, the American Dental Association position, is that they do not outgas, is that they are inert. Well, I have news for the ADA. This is not true. They do outgas, and they outgas from the time they're put in to the time they're taken out. When they outgas, what happens? Mercury is a known toxin. not a dental toxin. It's just a known toxin. It's very toxic to the neurological system. It's very toxic to the gastrointestinal system. It ties up candida, some people will call it. And so if you have a candidiasis or candida infection, or you have gut dysfunction, it's going to mess with that. It's going to be very difficult to fix your gut. It also it has an affinity for fat tissue, and since we're all fat heads, it goes to your brain. Okay, so it has a great affinity to cross the blood-brain barrier, to cross the placental barrier. That's really bad news, because that's supposed to be a sterile environment, and it causes memory loss, it causes fatigue, it causes brain fog. I can tell you story after story after story of patients that have had their mercury fills removed the proper way. We put all the garb on them. We make sure that there's no vapor escaping into the crossing the blood-brain barrier, the placental barrier, and they come back months later and we say, "How are you feeling?" They go, "I feel a whole lot better."
As a dentist, do you find that it's important if let's say you have a patient that has cancer, is it important to you to remove the mercury fillings from their mouth? Do you remove mercury fillings?
Yeah. Frequently, I remove the mercury material because it is a toxin for everyone and for the environment. Yeah. So I have just vacuum to aspirate the vapors of mercury.
Okay. I know that's important. That if there are some dentists that say they will remove the mercury, but if they don't have the proper equipment, it could be much more dangerous for the patient. You've got that equipment here. Somebody that's watching this documentary, can you connect the dots, or at least try to correlate how important it is what you do in preventing and even treating cancer? How are they connected, in case somebody isn't understanding how this is connected to cancer?
Basically, if the patient is a cancer patient, he needs to accept the chemotherapy or radiation therapy. Their immune system will be destroyed. So if the problem of the mouth do nothing before the treatment, they will happen severe clinical outcome when they treat the cancer.
That's very interesting. Dr. Lo Tueo is saying that if you are going to undergo chemo and or radiation, it's vitally important to clean up your mouth before, otherwise your outcome won't be as good.
I've interviewed several dentists that believe that you can't safely perform a root canal and disinfect the tooth. They believe that if you root canal a tooth, that you're going to seal in some of the microorganisms and it will cause problems down the road. Do you believe that you can safely do a root canal, or do you recommend that you just pull the tooth?
If the root canal system may not check the microorganism, or we don't use APDT or ozone in the pulp system, even we finish the root canal feeding, the disease will recur. We need to look at the intrapulp structure, and we need to face the infection situation. If the 2 points we can achieve, the root canal therapy will be successful.
Dr. Lo Tueo is the only dentist I've ever interviewed that has discovered a method to successfully perform a root canal using ozone and ADPT therapy.